Dr. Laura Dean. I'm one of the breast radiologists in the Department of Medical Imaging.
Dean and her Cleveland Clinic colleagues began to notice something unusual on mammograms when the COVID vaccination program began.
What we are seeing as a pretty common side effect, enlargement of lymph nodes under the arm on the same side as the vaccine is given. And we're seeing this very, very frequently. It's a normal and expected response. And basically, it's just an indication that the body is doing exactly what it's supposed to do. We're delivering the vaccine into the arm in hopes of triggering that immune response to the coronavirus as a stimulus.
While some lymph node enlargement is common after any vaccine, with the COVID vaccine, it's very pronounced.
We're still learning exactly how long these lymph nodes stay enlarged after the COVID vaccine. What we typically expect is that in most patients, they will go back to normal about 4 to 6 weeks after the dose is administered. Some patients may have prominent lymph nodes that may go longer than that, up to possibly 3 to 4 months, and we're still kind of learning as we go. It is one of the things that we look for on a mammogram is lymph node enlargement, which rarely could be a sign of an abnormality in the breast or possibly something like a lymphoma or a different type of cancer. The vast majority of the time that is not going to be the case, but it is because of that rare possibility that a cancer could present as an abnormality in the lymph nodes. And that's why it's been really helpful. We've really had to tailor how we interpret these exams, including taking the history from the patient of a recent vaccine in that side.
This doesn't mean you should delay your mammogram.
We really want patients to come in for their screening mammograms. We do know that a lot of patients may have postponed their necessary preventive medicine, including mammograms, during 2020, kind of in the height of the pandemic. We really want to encourage patients that it's safe to come in and get those really important screenings. It's so important for their overall health. And so what we're doing as patients are getting these COVID vaccines is we're asking them questions and we're including that in their medical history. So as the patient comes in for their mammogram, we really want to know, have you had a COVID vaccine? If so, where was it administered? Was it in the right arm or the left? Which vaccine manufacturer did you receive? That really helps the radiologist as they're interpreting that exam. It's really important for patients to come in for their screening mammogram. We especially want them to come in right away if they notice a new symptom in their breast, anything that they're worried about or that they think is a change. And these are specifically things like a lump, a mass, or an area of thickening, changes of the nipple, changes of the skin or redness of the skin, lumps under the arm. These are all things that may end up being normal, but we certainly want to evaluate them to make sure that it's not a sign of a bigger problem.
For Fox 8, I'm Dr. Marc.
Dr. Marc is sponsored by the Cleveland Clinic.